Our kidneys are sophisticated processing machines. Every day each healthy kidney purifies about 200 quarts of blood. Considering that the entire circulating blood is 5 quarts or so, each kidney filters that blood 40 times a day. This great work is done by the filtering units called nephrons. Nephrons work strenuously to remove waste material from the bloodstream as well as regulate water, electrolyte balance and acid levels in the blood. Every kidney is made up of an average of 1 million nephrons. During kidney disease, our nephrons fail to work as well as once they did. Progressive nephron failure then causes excess waste to remain in the body. If left untreated, kidney disease can cause serious health issues like electrolyte imbalance, fluid buildup known as edema, anemia, mental problems, heart disease, and even sudden death. Thankfully, kidney disease is absolutely preventable in most cases. In general, there are 6 major conditions that can attack our nephrons, causing them to lose their purifying capacity. If you have any of them, make a plan to fix it as soon as possible. The first one is diabetes. 20 to 40% of diabetic patients ultimately develop some degrees of kidney failure known as diabetic nephropathy. High levels of blood sugar can cause overproduction of detrimental chemicals known as reactive oxidant species. These chemicals have significant toxicity on renal blood vessels as well as nephrons. Damage to blood vessels and nephrons then allows large molecules like blood proteins to leak from the blood into the urine. Just remember that nephrons as kidneys filters never allow large molecules to leak in the urine. So the first sign of diabetic nephropathy would be excess protein loss in urine, also known as proteinuria or albuminuria. Albumin is the most abundant protein circulating in blood plasma. It is produced by the liver and accounts for nearly 50% of all plasma proteins. If left untreated, asymptomatic albuminuria then progresses to advanced kidney failure. Second is hypertension, a medical term for high blood pressure. In fact, hypertension is both the cause and effect of kidney disease. After diabetes, hypertension is the second leading cause of kidney failure. Hypertension can narrow, weaken and harden blood vessels. When the blood vessels supplying the kidney tissue become damaged, nephrons don't receive the essential oxygen and nutrients they need to function. Without nutrients, kidney cells don't have enough energy to work as they should, resulting in waste material buildup in our body. On the other hand, chronic kidney disease is a common cause of hypertension as well. Studies have shown that resistant hypertension is 2 to 3 times higher among patients with kidney disease compared with general population. Third is taking certain pain medicines known as NSAIDs on regular basis. NSAIDs like ibuprofen, naproxen and diclofenac are generally safe and commonly used drugs for relieving pain. But they are commonly known as nephrotoxic agents, meaning they can harm kidneys through different ways. A study on over 31,000 patients with hypertension showed that taking NSAIDs for more than 3 months increases the risk of kidney disease by 30%. That's because NSAIDs induce kidney injury by damaging both the nephron as well as decreasing renal blood flow. With these detrimental effects, NSAIDs can obviously impair the function of nephrons and induce kidney injury. So, if you suffer from chronic daily pains like knee pain due to advanced osteoarthritis, or severe headache due to migraine, then you definitely need to visit your doctor and use safer and more effective treatments instead of overusing freely available NSAIDs, especially if you have diabetes or hypertension, as top 2 leading causes of kidney failure. Next is kidney stone. In general, a kidney stone larger than 6 mm can't pass on its own, warranting prompt medical intervention. Besides, not all stones are symptomatic, meaning a stone former may have one symptomatic stone and many asymptomatic ones. Both symptomatic and asymptomatic stones may get trapped in your ureter, a tube that carries urine from the kidney to the bladder. When this happens, the flow of urine out of the kidney is blocked, causing urine backflow up into the kidney and subsequent kidney swelling, a condition known as obstructive uropathy. Buildup of urine inside the kidney then can cause damage to your kidney tissue, or even kidney failure over time, a condition known as obstructive nephropathy. So never underestimate your kidney stones. A tiny asymptomatic stone needs to be treated ASAP. Otherwise, it is enough to block the urine flow and cause gradual kidney failure. Fifth is smoking. A meta-analysis on over 65,000 patients with chronic kidney disease revealed that ever smokers are more prone to develop kidney disease compared with never smokers. Besides, smoking cessation significantly reduces the risk of developing kidney disease. That's because smoking can bring about vessel wall damage, oxidative stress and direct damage to nephrons. On top of that, smoking is linked to insulin resistance in both diabetic and non-diabetic patients. As a reminder, resistance to insulin hormone is a predictor of albuminuria and chronic kidney disease. The last one is obesity. A large study on over 1.4 million adults in England revealed that, with higher body mass index, the risk of developing advanced kidney disease increases steeply and progressively. Just being overweight increases the risk of kidney disease by 40%. Extra weight forces the kidneys to overwork and filter wastes above the normal level. Over time, this extra work raises the chance of getting kidney disease. Plus, obesity can cause ectopic fat to deposit in renal sinus, developing fatty kidney. This ectopic fat buildup is linked with hypertension and kidney disease as well. It's noteworthy to say that diabetes, hypertension, NSAIDs and kidney stones are direct causes of kidney disease, while smoking and obesity are the risk factors, meaning they make our kidneys more susceptible to developing kidney disease. Besides, to learn more about early symptoms of diabetes and insulin resistance as the leading cause of kidney disease, watch the next video.